Hey everyone, I'm your host Anthony. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching. All right, hello everyone, and welcome to the Lab Ordering Masterclass. I'm extremely excited to have you all here. My name is Anthony, and I'll be your host for today. I'm joined by our presenter, Tara Viswanathan, co-founder and CEO of Rupa Health. I'm going to pass it off to her in just a moment, but before we get started, I'd like to go over a few housekeeping items. First, everyone is muted by default. And second, if you have any questions during the course of this live class, please submit them in the chat panel. The questions will come to me as the host, and we will be conducting a live Q&A at the end. With that said, I'd like to pass it off to Tara to start the presentation.
Amazing. Thanks, Anthony. Should we wait a minute for people to join? Do you want me to dive in?
I think a couple of people are trickling in here, but I think we are pretty much good to go here to begin the presentation if you like.
Awesome. Okay, cool. Let's do it. Hi, everybody. So good to, I was going to say see your faces, but I guess like see your pictures and names. Normally we do this in smaller group settings. And so we actually get to know you one-on-one. If you ever want to schedule a demo with us, you're welcome to do that on our website. But I'm so excited to talk to you today about labs and the importance of labs in your functional or integrative practice, and how getting labs right can truly power your practice and take it to the next level. So cool. I think everybody can see my screen here. And by the way, feel free to type in questions to the chat. We are going to do a Q&A afterwards. And so Anthony will be receiving all of the questions, and then he will be asking them at the end, and we'll make sure to reserve some time for that. So thank you for spending some time with us. We're excited to have you here. All right, so let's dive in. As Anthony said, hi, I'm Tara. I'm co-founder and CEO of Rupa Health. We have dedicated our lives to making LabWork super easy for y'all, but today we really want to talk about why this is important. And by this, we mean why the process of lab work and getting it right in your practice is so important. So welcome to our Lab Ordering Masterclass. Awesome. First off, I want to take a quick moment to give a special shout out to our sponsors. So thank you so much, Dutch, Doctors Data, and Precision Point. Y'all are awesome. It's been such a great pleasure working with y'all, and you're the reason why we're able to do this today. So thank you so much to our three sponsors. All right. Just a quick recap, just a quick agenda of where we're headed today. So we're going to go over a couple different things. So first off is the pain points of ordering labs. Each of you, if you've ordered from these labs before, you probably experienced these, but just want to go over that a little bit in depth. And then want to talk about how the process of ordering labs will affect different types of practices. And then we're going to dive into how practitioners are currently ordering and managing their lab work and what the process has been to date. And then finally, we're going to go talk about building the future of lab work and what a really great lab work process will look like once you have it nailed in your practice. And then finally, I'm going to walk you through a little Rupa Health demo. We'll dive into all the nooks and crannies of the software to show you, to give you a little bit of a taste of what we do and why we've dedicated our lives to building this for you. Cool. Let's dive in. So this is probably familiar to many of you, but sometimes lab work cannot be so fun. And shocker, I know. But here are some of the not so fun parts of ordering lab work. And if you are brand new to your practice, if you haven't started, if you've never ordered labs before, these are some of the problems that you might run into when beginning on your lab work journey. So many of you are managing 3 to 6 plus different portals and different accounts for all of the lab companies. Many people are even having 15 to 20 different portals, because not every different lab companies specialize in different things, and you want to be able to have all of them at your fingertips. And so what many people are doing is having separate individual logins and accounts with every single lab company. Another one is handling payments for cash pay labs. We know that this can be frustrating on many levels. One, it's extremely expensive for patients. And so how do we, right now, it's just, patients are paying out of pocket. Sometimes there's financial hardship. So what can we do about that? But then also it's just the logistical experience of handling cash payments. So whether you are collecting on behalf of your patient and paying the lab versus having the patient pay the lab directly, even having price transparency can be difficult sometimes, and knowing exactly how much a patient is going to be charged. Also, many practices are set up differently. Some of y'all are doing memberships, some of y'all are doing group classes. Like there's many different ways that this is handled, and many times the labs don't have flexibility to do payments in different ways for you. A third way is tracking results that come in from different labs. So it is not just ordering the lab work. It's when results come in, you're having to then go into the different portals of each lab company and actually see, obtain results one by one. And let's say that you've ordered 4 tests from 4 different companies for a single patient. You might get an email notification. Sometimes you won't even get an email notification that a result is in, but then you don't know you don't remember how many other tests might have been ordered for that single patient. So that can be a logistical issue, is tracking the results as they come in from different labs. Another one, and we hear this one so frequently, it can be a nightmare for some people, especially if you're a virtual practice, is coordinating phlebotomy. So each lab has different instructions on their phlebotomy blood draws. Some of them need centrifuge, some of them need ice packs, some of them can be sent, some of them need the serum separated. And so there's so many nuances to this. And then top that with not knowing who is available in the patient's area or who is going to be close by to their home or office. It can be a complete nightmare. And so this is one of the biggest frustrations and issues that we hear from practitioners. And then finally, and then again, this is not comprehensive. These are just some of the most common frustrations that we hear from practitioners when they have gotten started ordering from each lab individually. Another one is patient support. So this is something that I think gets overlooked a bit in terms of, the process of ordering labs. You don't really think about patient support, but what happens is at the end of the day, it's an experience that reflects on your practice, basically how the patient is going to go through their lab work. And so in terms of helping your patients and walking them through what is typically a very complicated process, hand-holding them through requisition forms, collection instructions, sample issues, really needing to build out staff for this, because there's nobody currently in the lab ecosystem who can really help with a lot of this patient support. And we see a lot of patient drop off because of this. So getting the patient support piece really nailed in can be critical to having a workflow where patients keep coming back to your practice. Awesome. So how does the process of lab work affect your practice? This is a little bit of what we hit on in the previous slide, but it's really in 3 categories. One is patient compliance rates. The second is the actual patient experience. And the third is the practice efficiency and profitability. Because let's face it, if you're not able to maintain a business, you won't be able to actually serve patients and do what you're here to do. So let's dive into each one by one. On the patient compliance rates, this is kind of what we were talking about with patient support, but sometimes chaotic systems can lead to bad follow-up, can lead to poor compliance. And so typically you'll see quite a bit of patient drop-off if you haven't smoothed over that lab process, if you don't have people checking in on the patients, if you don't have automated reminders going out and things like that. And so if your patients aren't even completing your labs, they're not going to be following the protocols and coming back in your office. So this is something that is really important, is getting the patient compliance rates for the lab testing to get as close to 100% as possible. The second one is the patient experience. So as we mentioned, how is your patient paying for the labs? How do they know how much the lab costs? It's not easy today to figure out exactly how much a patient's going to pay, especially if sometimes they're using insurance. Or if the price can be hidden or different based on a provider price and a patient price. Another one is, how is your patient receiving collection instructions? Do you call them and walk them through this? Do you have your own instructions that every patient receives? Because if you're just many times if you hand them a kit, the instructions in there are not enough. They need a lot of assistance. We hear questions all the time, things like, well, I'm on this specific supplement or this specific medication, can I still do the test? And you hear all of these nuanced questions because our patients, the people who are coming to you, they are in the highest need. They've probably seen 5 to 7 traditional doctors before, and they're on a whole barrage many times of medications and supplements. And so it's not as simple as walking into a Quest or LabCorp or getting your blood drawn and being on your way. It is many times even a month of preparation to do a test and to get it right. And lastly, who's your patient talking to when things do go wrong? And so as you can imagine, many parts of the lab ordering experience are a human process. So collecting the sample is a human process. Mailing the shipment in, at the lab, analyzing the requisition, and things do happen. There are specimen recollections, and unfortunately, we wish it weren't the case, but these things happen. And who on your team is the patient talking to when things go wrong? Because this also ties into the experience, ties into the compliance rate. Many times, if your patient has a bump in the road, they're not going to complete their kit. And so you need to make sure that you have somebody talking to your patient and supporting them when things do go wrong. And lastly is practice efficiency and profitability. So this gets to the core of why we're here, right? How do we know that labs is so important. Getting to the root cause is critical in our line of work. And you can't do that without adequate lab testing. And so how do we then get you to be able to spend more time with patients and less time on the administrative side of things? And this is critical to even that face-to-face time. That's why patients are coming. And so inefficient processes leads to wasting practitioner your time and or your staff's time. So getting this right is really critical to running an efficient practice and being able, at the end of the day, if you can't stay afloat from a profitability standpoint, you're not going to be able to see patients. And so this is really about how do we streamline the entire lab process so that it's a virtuous cycle of supporting patients, getting them in the door, explaining what's going on, and then getting them back in the door for their protocols. Cool. So here's the current way most practitioners are ordering labs. So as I mentioned, most practitioners have about 3 to 6 different lab accounts, and they're ordering directly from the labs. This means logging into each individual portal. This means keeping track of long lists in each individual portal. This means typing in patient information over and over again in each different portal. You get the gist. Sometimes they're going to have an EMR that will import a few of the results from some companies, but not always. Sometimes they're uploading PDFs. Sometimes you are like hand adding in values for blood tests. Sometimes you're going to have some practitioners have an Excel spreadsheet to track results. I know I had this like pre-Rupa for myself. So I know how painful this can be, but it's so important to get these results and be able to use them in your diagnosis that practitioners will go to lengths like spreadsheets to do this. And then sometimes there's just no tracking and management system in place, and everything is done by hand. Awesome. So all of what you just saw in the last few slides are why, again, we're dedicating our lives to building the future of lab work. That is what we do at Rupa. We want to make this process so much simpler for you and your staff and your patients, and make it even an enjoyable experience. So what does that look like? What could that future of lab work look like? Well, here's kind of the tip of the iceberg. One is ordering and managing lab work all in one place. So rather than having separate portals, it's one place to both order, receive results, have customer support interactions. Everything goes through one place. And also like a way for your staff and the practitioners at your clinic, if you have a multi-practitioner clinic, to all be operating out of one operating system. Number 2 is solving all of those major pain points around lab work. So, we talked about everything from the specimen issues, the pricing, to all of that. So the future of lab work really looks like better financial, better models of payment for patients. So clear price transparency, supporting with insurance billing, things like that. It's payment plans. It is being able to pause and delay your orders if now it's not the right time. All of those things. It's just a drastically better, and this gets to the third one, experience for your patients. It's hand-holding your patients. It's sending reminders to them, digital reminders. It's text message orders. It's kind of everything you would expect from an Uber or an Airbnb or any of those experiences. It's what patients are expecting now from any healthcare practitioner that they go to, and you want to be able to deliver that level of care. And then finally, it's running a more efficient, profitable clinic that enables you to spend more time with patients. And simply put, what that means is less time on administrative and more time with your patients. Awesome. So with that said, I'm going to walk you through a quick little demo of the Rupa portal and talk and show you why many practitioners, thousands of practitioners all over the US are using Rupa to order and manage their lab work. Cool. Give me 1 second here. And again, please feel free to drop questions in the chat, and we're going to do a Q&A afterwards. You'd think after like a year and a half of Zoom calls, I would figure out how to screen share properly and pull everything up, but I haven't. So we're getting there. All right. Amazing. So welcome to Rupa. This is your login page. So what you're going to do is when you create an account, you'll be able to, by the way, sign up and create an account in approximately 3 to 5 minutes. It's very, very fast, and place your first order. So the entire experience is immediate, and you actually don't need to have accounts with all of the labs. We will do that for you. So at Rupa, you get access to over 20 different lab companies and over 2,000 different tests all in one place. I'm going to show you exactly how that works. Great. So we're going to sign in, and this is your Rupa dashboard. So I'm going to walk you through the lab test catalog, placing an order, and then the patient experience, and maybe if we have time, some fun little extras as well. But hopefully we'll be able to do some more time face-to-face, another time to walk through all the details of how it can be customized for your clinic. I do want to mention, by the way, that we work with everybody from solo practitioners all the way to large hospital systems. So we are fully HIPAA compliant. We are our software is very flexible. So no matter if you're just getting started or you have a giant established practice, we can support you with that. And we can help you configure your account to do that as well. Cool. So let's dive in. Right over here on the left is your control panel. This is your navigation, and you'll be able to access everything from the test catalog, messages with our team. This is like your one-stop shop for customer support. Your settings where you can add admin staff and people like that, and then all kinds of resources, FAQs, an up-to-date lab turnaround time table. And then your support center with tons of videos and helpful guides to help you walk through the Rupa platform. Awesome. So diving into the lab test catalog, this is one of the maybe the only place where you can find a complete list of over 20 different labs, 2,000 different tests, and price comparative. This is incredible. We've heard this is incredibly valuable for practitioners who are trying to find the best price for their patients. So for example, and different options. So for example, if you were looking for stool tests, all you would do is click on the stool filter, and you'll be able to see all the different stool tests from all of these different companies in one place. You can sort it by popularity, alphabetical, and price as well. You can also filter by phlebotomy. Sometimes patients, especially if they're in remote locations where phlebotomy is not available, or if you need something on a faster turnaround time, or if price is a barrier for phlebotomy, you can search for tests where phlebotomy is not required. So for example, through COVID, we had many practitioners who were searching for thyroid tests, for finger prick and blood spot thyroid tests, and you can very easily do that right here. You'll also be able to click on details and get a complete, at a glance, view of everything you need to know about this test: the shipping time, the average sample processing time, collection instructions, and then the details and the markers assessed. Awesome. So again, you'll be able to start an order right from here or from the dashboard. I'm going to go back to the dashboard now. Awesome. And by the way, this is being recorded, so you'll get a recording of this. If I'm moving too fast, I apologize. I want to make sure that we have time for Q&A. Okay, awesome. So this is your dashboard, and this is where, at a glance, you'll be able to see all of the different orders that you've placed for your patients. So for example, here are different patients. And this is, of course, a demo account. I wish Oprah and Ruth Bader Ginsburg were actually my patients, but they're not. And you'll be able to see the status. Is it in progress? Are all the results in? Was it sent to patient? What's going on? So it's your at a glance. Each order can have one or more tests from one or more companies. So let's actually go and create an order right now. So I'm going to start an order. All you're going to do is enter a patient's name. So I will just pick a name. I'll do, you know what? I'm going to do Sarah Blakely. Oops. Actually, let me do someone else. I'll do Sarah Henderson. And all you do is click enter, and then you can type in an email address. I'm going to type in a fake email address. And I'm going to start order. And it's that simple. Now you've added a patient and you can create an order for them. So now what you're seeing now is your ordering panel. And this is kind of one of the powers of Rupa, where you now have all of your favorite tests, your most commonly ordered tests, in one place. Shout out to our sponsors here. And you can, all you need to do to order them is from Dutch, Doctor's Data, and Precision Point, you just click on the 3 different tests you want, and then they're automatically in your cart right here. You see a total price for the tests. You can either choose to pay for the order or have the patient pay. And then you just send it to the patient. There's a lot of other customization here you can do. You can add a text message. You can add ICD codes. If there's a test with insurance available, I can pick one. An insurance option will pop down as well, where you can say insurance option, and it can be insurance for Genova tests only. There's all kinds of stuff. And right now, by the way, we do insurance for Genova and we do Medicare for Genova and Diagnostic Solutions. So yeah, so this is how simple it is to place an order in Rupa. Enter the patient's name, their email address, 3 different clicks, press send, and you're done. Until the results come in, our team will take care of everything, including instructions to the patient. Any questions that the patients have will come to us and we can triage them. We will keep you posted on communications we have with your patients. We will make sure that it gets paid for, all of that. We handle specimen issues, everything. And I'm going to walk you through all of that in a second. But just so you know, all you're doing is pressing send and then waiting for results to come back. You can also, this is a new feature we added, is create your own custom bundle. So if you if you have a thyroid health panel that you've created, or a heart health, or anything like that, or sports recovery, you can create a custom bundle. And so it would be essentially clicking one button to order multiple tests. Awesome. So we're going to send that to the patient and order submitted successfully. This was a patient pay order that we submitted. And now we can see, by the way, here's Sarah Henderson sent to patient, and we can view the order. And as you'll see, it'll say pending patient payment. You'll be able to see the date updated, and this is one order. Up until it's paid for, you can edit it or you can cancel it. You'll also be able to see these order events, which is essentially a timeline of what happened with your patient's lab order. We tell you when the invoice went out, when the email went out, when instructions went out. If your patient responds to any follow-up emails we have, we'll let you know as well, and when results come in. So you have a detailed history detailing what happened with your patient in this lab order. Fantastic. Okay. So before I walk you through all results in and what that looks like, let me show you an in progress order. So at a glance in one portal, you're going to be able to see this is an order that is in progress, and you'll see, oh, the kit was shipped. I ordered 3 different labs from 3 different companies, and one of them, the kit was shipped to the patient. The next one, the results are in. And the next one is sample arrived at the lab on a certain date. So at a glance, you're going to be able to see what is happening with the patient's labs, and should you be reaching out to schedule a follow-up. Awesome. So please excuse my atrocious inbox, but I sent this to myself so we could see it. This is the, I got to inbox 0 maybe a month ago. Oh no, what's happening? Apparently did not stay that way. Oh no, I'm having, technical issues, but that's okay. Oh, there we go. Amazing. So this is the order we just placed. It says, this is what your patient's gonna get. Hi, Sarah, Dr. Tara Viswanathan, that was me, has ordered lab testing for you. Here's who we are. So I wanna talk about pricing for a minute. all of our tests on Rupa are the cheapest wholesale practitioner pricing that you can get for your patients. The way we make money, the way we stay alive is we have a 7% service fee on top of every order. And that is very clear to the patients. And I'll show you what that looks like. But we offer, because in many cases, because of the practitioner wholesale pricing, the service fee is actually offset by the discounts that we can get for your patients. Additionally, to help make this more affordable for your patients, we have HSA, we accept HSA and FSA across the board for all of the tests. We also offer a 3-month payment plan, interest-free payment plan. So patients can pay over an installment rather than paying all up front. And as soon as they make their first payment, not all 3, the labs will get shipped out and processed. And we have quite a few patients take advantage of that. Great. So this is what your patients are going to see. So it is a very clear, and you can compare this to your patients just getting a kit in the mail and having no idea how much it's going to cost them, and not being sure if they want to do it up front. They see everything up front. So their name and email are already filled in because you had that. If they're already in our system, all of this information will be filled out. They just need to confirm it. They consent to letting us view their results, and they can pay right here. They can also, at a glance, view the details of the lab tests, and they'll get proactively reach out. They'll get proactively notified that they'll need a blood draw for some of the kits. Great. If they're not ready, sometimes they want to pause, either delay or cancel this order. And what they do is just click this button, and they'll automatically get a reminder at this date. So that entire workflow is created for you, and you don't have to do any, you and your staff do not have to do anything at all. Great. And then right here, oh, by the way, you'll be able to see the processing and ordering, which is our service fee. And then again, here's a Rupa savings from getting the wholesale price. Awesome. So I'm going to take you to a resource now that will be very helpful for y'all, which is our patient experience page. Here's a video, by the way, that we have created to explain what your patients experience whenever you place an order. I'm going to walk you through this page, and it's just rupahealth.com/patient-experience. So immediately, and this is what we saw, when you place an order, your patient is going to get an email from us. And by the way, if you pay, the patient doesn't see any of the pricing or anything like that. They just have to sign the consent and send their shipping information. Then within 24 hours of payment, we're going to notify your patient whenever their order has been shipped. So tests are drop shipped directly to the patient to whatever address they choose. We do have about 6 labs that we have what are called in-office kits for. So we will, for those tests, we will be able to ship kits to your office, and you'll be able to still use Rupa and have everything tracked through them, but hand off the kit in person. And that's a separate kind of workflow. And if that's something that's interesting to you, if you're an in-person clinic and want to hand off kits to your patients, definitely reach out to our team and we can help you with that. So we let them know expected arrival dates. We send them their step-by-step instructions. We send all the FAQs. The goal here is to reduce all of the back and forth that is coming to you while creating an experience that is phenomenal and way above the bar of what your patients are expecting. So a couple days after the kit shipped, your patients are going to get a personalized instructions page. So here's a live example of the personalized instructions. So for all of the tests that they have, for every single test on our platform, we have custom human created and written instructions for each test that basically go over, from the thousands and thousands of patients that we've seen, we know what problems they're going to run up into. And so we put the key details up at the top. We give the prep and timing for, especially this comes in handy for some of the really complicated tests like the Nutri eval and things like that. But here's the prep and timing. There's videos, all of it. What do you do if you have an irregular cycle? Collection instructions, it can be quite complicated and comprehensive. And so that's why we've taken the time, our team has, to develop these instructions and proactively give them to your patients so that they can prepare. Then we have examples of what requisition forms should look like. In most cases, they're almost entirely filled out, but sometimes we need a signature, a date of sample collection, things like that. So here, this is what patients see. Fill in the date of sample collection, ensure information is written correctly, do not fill this part, add a signature. Like it's very kind of foolproof way so that you're not getting any questions on requisitions anymore. And then finally, we actually help solve the phlebotomy problem, which is a huge reason why practitioners use us, and something that we have recently started to offer, which is we will proactively help send them phlebotomy options. So if you have a preferred phlebotomist, or if you want them to come into your clinic, you can set a custom phlebotomist for your clinic. So only your patients will get emailed those instructions, and we have that for quite a few of our clinics. If you do not have anybody, we can help your patients find phlebotomy. And so I want to go back here. But yeah, so we send your patients resources to help them understand phlebotomy options. So there's multiple ways we do this. We work with the lab to find good phlebotomists in their area. We work with your patient directly. And if you have somebody, we can help them as well. We can include them in the custom email as well. And then the requisitions, as I mentioned. And finally, we check in to see how their sample collection is going. So remember the drop-off piece? This is built to reduce the drop-off and increase patient compliance. So we're going to check in with your patients and see how their lab tests are going and if they need any help proactively. And they'll let us know if they've completed their tests, or they're planning on completing it, or they don't plan on completing it, and we'll let you know what the result is as well. And then here is this I want to highlight. When results are in, you do not need to go check portals every single day to see if results are in. At a glance, you and any staff you choose are notified via email. So what this looks like is, let's say you ordered 3 different tests from 3 different companies. The email is going to proactively tell you 2 of these test results are in, 1 you're still waiting for, and here are the dates that they came in. And so at a glance, you're going to be able to know whether you need to schedule with that patient or not. And this is all going to be sent to you proactively. And this is such a huge help that we hear it from practitioners, that rather than having to go one by one, you get everything in one place. And then of course, if patients have questions along the way, we're going to guide them. But let me go back to the portal. So that email, when you get results in, when you click, you're going to come to a place like this. So this is what all results in looks like. You can view and download the results directly from the portal. You're going to get the same PDF workflow that you'd get from whatever results you normally get from the lab. You can get them here. You can also send them to your patients via a secure link. You can also request a clinical consult with the lab. You can also view educational lab resources as well. So there's a lot of power in all of this in the portal. You can also mark the test order as reviewed once you've either sent all the results to the patient, or when all the results come in and you've reviewed them with the patient. So this is all to keep you organized and help you honestly create an experience for your patient and your practice that didn't exist before. And significantly decrease the administrative load on your practice. Let's try to think. There's a lot of other things that can happen within the portal. So for example, adding in your custom test bundles, adding in your clinic information, adding in your preferred phlebotomist, all of this can be done by settings. But if there's anything else you need, anything specific to your practice, because we know every single practice is unique, and we want to make sure that if you're choosing to work with us, then we can set this up in a way where it's perfect for your practice. Just reach out to our team, and we have dedicated team members who can help you get this perfectly customized to your clinic. But that's it for now. You've heard me talk for 34 minutes now. I need to get a glass of water or something. So let's move on to the Q&A. I'd love to hear what you think and answer any questions y'all might have.
Thank you so much, Tara. That was amazing. So yes, you did a perfect job. Let's jump into our Q&A session, and we did get a number of questions here today. So let's go into the first one, and that is, how frequently does Rupa send out reminders to patients to get testing done?
So thank you so much for asking this question. It's a great question. I'm assuming it means after you've actually placed the order to the patient. And so we send about, it really depends, they're going to get, let's go back to this patient experience page. They're going to get their first email, which is the payment email and the consent email. And if they don't respond to this, we follow up about 3 to 4 more times. We will let you know, and you will see in your portal if somebody hasn't responded to this. Then we probably send 3 or 4 more proactive messages about the instructions and all of that. And then we will follow up 2 weeks after the test kits arrive to see and follow up, see if the patient has completed the test and follow up. So in total, it's probably about 7 to 8 times.
Perfect. Thank you so much. Question number 2 is, are you integrated with Charm, EMR, and any others?
Great question. We are, right now we have an integration with OptiMantra. So if you order with Rupa, all of your results will come in through OptiMantra and be attached to the correct patient chart. It's magical. We are working on integrations with a couple other EMRs. Please reach out to your EMR and tell them to have a results integration with us. We can definitely send all your results over to different EMRs. We'd love to hear which ones are important to you. Right now, we do not with Charm though.
Thank you. Next one is, can LabCorp and Quest Labs be ordered through Rupa Health?
Great question. No, they cannot yet. So right now we are entirely focused on the functional labs. You can order basic blood work through Boston Heart, Vibrant America, and Access Medical Labs. So these are the 3 lab companies that do the basic blood work that you would get from Quest and LabCorp. They are all cash pay though. So if you are looking to order from Quest and LabCorp and do insurance based, you'll need to go through them right now. But this is something that we are working on and will be out within the next year or so.
Thank you for that answer. All right, moving on to question number 4 is, where do my patients get their blood drawn? Do you have a contract with Quest or any other lab, which you just answered, but where would they get their blood drawn?
Yeah. It really depends. Phlebotomy, if you try to find phlebotomy for your patients, you know what a disaster that can be. So to put it nicely, it depends. We have a giant network of phlebotomists in different locations and work with different companies. We are not contracted with any one person because the reason is because there is no one person who could cover our entire US basis. But we do have a network of tons of phlebotomists, and we'll be essentially like sending your patients options.
Amazing. Thank you for that. All right, moving on to question number 5. When will this be available to practitioners that do not have a license for certain tests?
Great question. So that is something that we're actively working on, is making that available to a wider group of people. Reach back out to us. We do have a wait list right now. And we can also discuss more your unique case more specifically and get a better answer on that.
Great.
And yeah, maybe we'll send out some notes about where exactly that wait list lives too.
Thank you for that, Tara. All right, I know we have a bunch of questions coming here today, so we're going to take a few more. When do the patients receive the results? The doctor wants to review them before the patient sees the results.
Yep. We do not send patients the results unless you send them the results or you have signed off on the results. So they will come to you and then you can release them to the patient. In some cases, it's actually a new feature. In some cases, practitioners want the results to go directly to patients. We have that option, but the default option is that it comes to you and then you release to the patients.
That is great. All right, a couple more questions here for you, Tara. Does the practitioner receive wholesale pricing too?
Yes. Yep. Same pricing for practitioners and patients. We want to make this as affordable as possible for everybody.
Perfect. And let's go for one more question here. Do you send a requisition to my local lab when a patient needs their blood drawn?
If you have a local lab, we can send either the patient or you will have access to the requisition. But we do not currently have a way to send it directly to the local lab.
All right.
What we can do is you would enter. So let's go to settings. You would enter the local lab information right here. And then your patient would get this, and you can just add notes for your patient that says, print out your requisition and take it to the local lab. And your patient will get the requisition through Rupa.
That's an amazing feature. All right, so we have a lot of questions coming in. Thank you so much for attending the live class today, though. I know we weren't able to get to everyone's question, but we'll be personally following up with all of you. So thank you so much again for attending, and thank you, Tara.
Yeah, thank you all so much. I'm honestly honored that you spent your Thursday hour with me. It means the world to us. We admire, our team at Rupa admires everything that each one of you do. And we hope to get to meet you face to face at some point soon.